February is Heart Awareness Month, a perfect time to stop, pause, and remind ourselves how common heart disease is and how early awareness, screening, and lifestyle changes can save lives. Joining us today is Dr. Vivek Kumar, Chief of Staff at Lakewood Ranch Medical Center. Let's start with awareness, Doctor. What do people need to know about heart disease?
Well, lots of different things, but if I have to start with one thing, it's just kind of knowing warning signs.
Yeah.
Particularly as we're also looking at Heart Month, but we're talking about women and heart disease. Many times people think about chest pain as their only symptom that they're going to get.
Right.
However, there's a broad range of different types of symptoms you might get as part of your chest pain associated with heart attacks. But much more commonly, I'll see in women as their presenting symptom is fatigue or shortness of breath. It doesn't always have to be chest pain. Not all chest pain is your heart, and not all shortness of breath are your lungs. So you have to look at both of these.
That's scary to think that something that common could be such a sign for heart disease. Where do we start with taking care of our heart?
Baseline assessment and kind of knowing risk factors that go along with it. Certainly if you have family members that have had early heart disease, the time to start looking for this stuff is by the time you've hit age 30.
Oh, wow.
Or even younger.
Wow.
Depending on how young mom was or how young dad was when they had their first event. You want to go at least 10 years younger than that. So, and sometimes I see people that mom had a heart attack at 35. And they're 33 and they're starting to think, oh, maybe I should look at it. Yeah, you should have been looking about 10 years ago.
Oh my gosh. As you said, screening is absolutely the key. Tell us some of the screening options that you have at Lakewood Ranch Medical Center.
So simple things start with just, and a lot of times the screening happens as a byproduct of getting something else done, or maybe you have to have an EKG because your pulse was irregular. An EKG is a perfect way to start. And cholesterol. Got to check the cholesterol numbers. And just kind of knowing a baseline of where you stand.
And continuous monitoring, I would imagine, as well.
Yeah, depending on where you start.
Yeah,
depending on where you start. Because if the numbers are very abnormal and you got that family history on top of it, you've already got two of your five major risk factors. The other ones are hypertension and diabetes, and you got to stop smoking. Nicotine is terrible for your heart, triples your risk of an event.
Interesting. All right. Well, like we said, another thing that you're very well known for is the range of cardiac intervention. Tell me a little bit about that. And we're going to talk about a piece of cutting edge technology, but talk about, you have a new center there, correct?
Yes, yes. So the hospital itself is just over 20 years old. It started out with one cath lab. We expanded about 6-7 years ago to 2 cath labs and just renovated our first one. So now we have 2 brand new cath labs. Where we provide a lot of different types of interventions. We provide intervention for heart attacks, so that's the coronary artery disease piece. We have interventions for abnormal rhythms or electrical wiring when it goes out of whack. You've got pacemakers and defibrillators. We have special types of newer pacemakers.
Yeah, let's talk about this new piece of technology, right? This is a leadless pacemaker. What does that mean exactly, and why is it important?
Typically, when people think about a pacemaker, they think about, oh, there's this big block of metal sitting in my chest, and I've got wires all through my chest.
Yeah. All right.
This pacemaker has no wires. So it's placed through a leg vein up through your leg, and we place it inside the heart, inside of each of the chambers. It's got a little corkscrew at the tip that screws into the heart muscle to hold it in place. And the battery life on these actually exceeds some of the big ones that we stick here.
Wow. Some of the crazy, great, cutting edge technology that you have there. What else do you have in our last minute? What advice do you have for people when it comes to being aware of heart health?
When you're having a symptom and you're not sure what it is, it's so easy to just get checked. There's lots of different ways to screen. At the hospital, we certainly have lots of different ways for screening. There's lots of other tools out in the community available for screening also. When it's not, doesn't feel right, don't blame it and say, it's my anxiety. I ate something. It's not that simple. And so many people miss it because they just write it off as gotta be something else. It couldn't be me that's having this cardiac event.
So if there's a question, it's there for a reason. Go get the answer.
Go get the answers.
And if you are looking for any more information or any answers, please check out LakewoodRanchMedicalCenter.com.